Thanks so much, Jason. Well, it's the day we've been talking about now for weeks. NBC25 has teamed up with the McLaren Cancer Center on Beecher Road in Flint Township to bring you free prostate screenings today. We are now joined by Kiran Devisetty, a radiation oncologist. Kiran, thanks for being with us. I'd like to start by asking you to kind of take us through what this screening is like for someone who maybe has never done it.
Good morning, Brittany. When patients come over today, they will be greeted by our front office staff and they'll be given a survey to go over their other medical history and if they've undergone PSA screening before. After that, they will be going to our clinic where a nurse will do a quick evaluation, after which a physician will come in to talk with the patient, again, review their history, talk about the PSA test, and we will be doing a prostate exam to see if there are any abnormalities.
Sure, and why do you think that most people avoid this, or maybe they're concerned? What concerns should people have, if any, when they come to this screening for the first time?
Well, cancer is a scary topic, and I think that's why many patients are hesitant to undergo the test. And also, many patients may know that the PSA test is controversial at this time. Regardless, it's important that a patient talk with his physician regarding what the PSA test shows and what it means and what the risks and benefits are. As far as when they come in, they're not going to be told they have a diagnosis of prostate cancer. Rather, it's a discussion regarding risk factors and then ordering a blood test in addition to doing an exam. Afterwards, we will follow up with them regarding those results to see if anything further needs to be done.
Great, and in your opinion, definitely, what would you call this screening? I know we're calling it life-saving. Would you agree?
If it's for the right patient population. The reason I'm saying it's controversial is the USPTF, which is the U.S. Preventative Task Force, does have some concerns about the PSA test if it's given broadly and without targeting. What we are doing is following the General Cancer Society recommendations targeting towards men who are age 50 to 75 and considered healthy, and in younger men starting at the age of 40 if they are African American or if they have a strong family history. It is in this patient population where there is a potential benefit to doing the PSA screening.
Okay, wonderful. Kiran, thank you so much for being with us this morning. Definitely great information that you just provided us with. And we want to remind our viewers this morning that this potentially life-saving free screening takes place tonight from 5 to 7 p.m. at the McLaren Cancer Institute on Beecher Road in Flint Township. You do not need an appointment for that. And we'll be right back.